Have you ever wondered why some people suddenly walk out of a dental clinic with a brand new, perfectly shaped tooth that looks almost too good to be real? Today we're diving into teeth crowns, those tiny superhero caps dentists place on damaged teeth. But here's the twist. There are a few surprising facts about crowns that most patients never hear about before sitting in that chair. Some of them might actually change the way you think about dental treatments. And luckily for us, we have the brilliant Dr. Esma here to separate myth from reality. Dr. Esma, is it true that many people misunderstand what crowns really do for a tooth?
Oh, absolutely, Rasim. Many people imagine crowns as just cosmetic caps, but the reality is far more interesting. A crown can completely restore a damaged tooth's strength, shape, and even protect it from future problems. Yet there are several things patients rarely realize, like how modern crowns are designed, how long they can last, and why dentists sometimes recommend them earlier than people expect. When patients understand these details, they usually feel much more confident about the treatment.
Now that's exactly the kind of behind-the-scenes insight we love on this channel. Because when people hear the word crown, they often think it's the last resort before losing a tooth. But today we're going to uncover 7 surprising facts that might completely flip that idea. Some of them are about technology, some about durability, and one of them, trust me, is something most patients wish they knew earlier. So stay with us, because the next fact might surprise you. Let me paint a quick picture, Dr. Esma. Imagine someone biting into a crunchy piece of bread, then suddenly feeling that tiny crack in a tooth. Not a dramatic movie moment, just that quiet thought. Something feels off. Many people ignore that feeling for weeks, or even months. They keep chewing on the other side, hoping the tooth will somehow behave again. But in the background, the damage slowly grows, and by the time they visit a dentist, the tooth might already be too weak to survive without protection. That's when the conversation about crowns begins. Am I close to reality here, or is this one of those situations you see in the clinic almost every week?
Rasim, that scenario is incredibly common. Patients often come in and say it only hurts a little, so I thought it would pass. But teeth don't heal the way skin does. When a tooth cracks or loses structure, it becomes weaker each time you bite or chew. Sometimes the tooth still looks normal from the outside, which makes people believe everything is fine. Inside, however, the tooth can already be struggling. That's why dentists sometimes recommend a crown before things become more complicated. It's not about rushing treatment. It's about protecting the tooth before the damage spreads further.
That's the surprising part, right? Many people think crowns appear only at the very last moment, when a tooth is already in serious trouble. But what you're saying is almost the opposite. Sometimes the crown is the thing that prevents the real disaster. Which means a lot of viewers watching right now might actually be walking around with a tooth that quietly needs protection without them even realizing it. So this is where it gets really interesting, Dr. Esma, because when viewers hear the word crown, they often imagine something purely cosmetic, like polishing the smile for photos. But what you're describing sounds more like a protective helmet for the tooth. And when you think about it, that makes a lot of sense. Teeth deal with enormous pressure every single day, chewing, grinding, sometimes even stress clenching during sleep. If a tooth is already weakened, it's almost like asking a cracked wall to hold up a roof. Eventually, something gives. Is that why dentists emphasize protection early, rather than waiting for the tooth to fail completely?
Exactly, Rasim. Think of a crown as reinforcement for a tooth that has already been through a lot, perhaps a deep cavity, a large filling, or even a root canal. Without that reinforcement, the tooth may continue weakening until it breaks in a way that becomes much harder to repair. When a crown is placed at the right time, it distributes biting pressure more evenly and helps the tooth function normally again. That is why dentists often recommend crowns, not just for appearance, but for long-term stability. A well-placed crown can allow a patient to eat, speak, and smile confidently without worrying about the tooth cracking further.
That perspective changes everything. Instead of thinking about crowns as a last-minute fix, people can see them as a strategic move to keep their natural teeth working longer. And honestly, that's a powerful shift in mindset. Dr. Esma, I recently read something interesting while preparing for this episode. Dental crowns are actually one of the most common restorative treatments in modern dentistry. That surprised me. Many viewers might assume crowns are rare or only used in extreme situations, but apparently dentists place millions of crowns every year worldwide. That means this procedure is far more routine than people think. And I imagine behind those numbers there are real stories. Maybe someone cracks a tooth during dinner, or a large filling finally reaches its limit. Suddenly, the dentist says, this tooth needs a crown. For many patients, that moment feels unexpected. So I'm curious, Dr. Esma, do you have a typical example from your clinic that illustrates how quickly a normal tooth can end up needing that kind of protection?
Absolutely, Rasim. Let me share a simple example. A patient once came in with a molar that had a very large filling placed years earlier. For a long time, everything felt fine, but over time, the remaining natural tooth structure became weaker. One day, while chewing something fairly normal, nothing extreme, the tooth developed a small fracture. Fortunately, we caught it early. Instead of losing the tooth, we prepared it and placed a crown that restored its strength and shape. Situations like this are incredibly common. Crowns are not just emergency solutions. They are often preventive restorations that help a compromised tooth continue functioning safely.
That's fascinating. So in many cases, the crown isn't about dramatic damage. It's about catching a vulnerable tooth at the right moment and giving it a second chance. Dr. Esma, this might sound like a simple question, but I think viewers are curious about the science behind crowns. When you look at a tooth from a dental perspective, what exactly happens structurally that makes a crown such an effective solution? Because to the average person, it looks like a small cap, but clearly there is a lot more engineering involved. Teeth handle serious force every day, sometimes hundreds of pounds of pressure, while chewing. So I imagine the crown has to distribute that force very carefully. Is that part of the reason modern dental materials and design have become so important in crown treatment?
You are absolutely right, Rasim. From a scientific standpoint, a crown works by restoring the structural integrity of a compromised tooth. When a tooth loses a large amount of enamel or dentin, it cannot distribute chewing forces evenly anymore. That is when fractures become more likely. A well-designed crown encases the visible part of the tooth and redirects those forces across a stronger external surface. Modern materials such as ceramic and zirconia are engineered to mimic the strength and function of natural enamel. They are durable, biocompatible, and shaped precisely so the bite remains balanced. In other words, the crown is not simply covering the tooth, it is rebuilding the mechanical stability that the tooth originally had.
So the crown is basically restoring the tooth's architecture. That makes the whole concept much clearer, and honestly a lot more impressive than people usually realize. Alright, Dr. Esma, let's walk viewers through the actual process. Because when someone hears the words, "you need a crown," the first question is usually, what happens next? Is it complicated, painful, or time-consuming? From a patient's point of view, the unknown part can feel a little intimidating. So if someone walks into your clinic tomorrow with a tooth that needs a crown, what does the journey actually look like step by step?
Great question, Rasim. The process is usually very structured. First, the dentist carefully reshapes the damaged tooth so the crown can fit securely. Next, we take a precise digital scan or impression of the tooth. That information is sent to a dental lab where the custom crown is designed to match the patient's bite and natural tooth color. While the final crown is being created, the patient often wears a temporary crown for protection. At the next visit, the permanent crown is placed, checked for comfort and bite alignment, and then bonded securely. Once finished, the tooth looks natural and functions normally again.
So the crown journey is really about precision. From shaping the tooth to designing a custom crown that fits perfectly, every step focuses on restoring both strength and a natural look. Dr. Esma, once someone has a crown placed, many viewers probably assume the job is done forever. But I suspect there are a few habits that can make a big difference in how long that crown actually lasts. Because crowns may be strong, but they still live in the same environment as natural teeth. Chewing, temperature changes, sometimes late night snacking. So what are the biggest do's and don'ts patients should remember if they want their crown to stay in great condition for years?
Great point, Rasim. A crown can last many years, but proper care is essential. First, patients should treat the crown tooth just like a natural tooth. Brush twice daily and floss regularly. Good oral hygiene protects the gum line around the crown. Second, avoid using teeth as tools. Opening packages or biting very hard objects can damage both natural teeth and crowns. Another important tip is regular dental checkups, because dentists can monitor how the crown and surrounding tooth structure are holding up. With these simple habits, crowns often remain stable and functional for a very long time.
So the secret isn't complicated at all. Consistent care, a few smart habits, and a crown can keep doing its job quietly in the background while you enjoy life and your favorite foods.